Okay, so we're up to topic 9, part 4. This is going to be finishing our topic, and then we've only got one more topic and we've finished the entire subject. Can you believe it? I can't believe it. It's been amazing. Okay, so we're up to the fourth function of the respiratory system, which is now that we've managed to undergo fertilization, which is when the male nucleus and the female nucleus combine into one nucleus. So we're going to develop that fetus, and then we're going to look at the birth of the baby and a brand new human. Brand new human. Okay, let's watch this little video that I have here about what happens to your organs as the pregnancy develops.
In your first few months of pregnancy, hormones flood your body.
Yep.
Your baby is still tiny, but already your body is changing. Your breast starts to swell and may feel tender. Tiredness, nausea, and frequent trips to the loo are common pregnancy symptoms. In your
Look at the baby
trimester,
growing.
Your rapidly growing uterus gradually rises up out of your pelvis. You'll start to feel the first flutters of your baby's movements, and an obvious bump will be showing by mid-pregnancy. In the third trimester, your growing baby pushes your intestines and stomach up. That's why you might be feeling breathless. And heartburn is a common problem too. Your bladder is also under pressure. You'll be making more trips to the bathroom, even more so when your baby's head engages, ready for the birth. These symptoms will go after your baby is born, but your uterus can take up to 2 months to shrink back to its normal size and position.
Isn't that amazing what happens to the female body? Wow. So let's have a look at, in more specifically, what happens to your organs during pregnancy. Where are they? Where do they sit? Do they move around? So this is a diagram of a non-pregnant female, and this is a diagram of a pregnant female late in the term. Now, I want you to answer all these questions, but I'll help you with the first one. What happened to the diaphragm? Can you see here? Look, this is your liver. This is the diaphragm. Look, this is the liver. The diaphragm must be up here somewhere. Okay, so the diaphragm gets pushed all the way up. Okay, it gets pushed all the way up. So have a look at all of these different structures and compare what does it look like when a person is not pregnant, and then where does your organ sit if you're actually carrying a baby. Right, now we're going to look at in more detail, some of the physiological changes associated in the maternal systems during pregnancy. Okay, let's have a look. So your uterus grows, big, it goes big, because your uterus is holding the fetus, and it also contains the fluid, and it also contains the placenta. So your uterus is growing really, really big. The mum needs to breathe more, okay? So not only is she breathing at a faster rate, the amount of air moving in and out is also increased. By this stage, the mammary glands have developed. Now, if you are never pregnant, you will never develop those mammary glands. So mammary glands only mature during pregnancy. Right, so with regards to your gastrointestinal tract, the mother needs to eat for the baby and also for herself. So that means that her nutrient requirements are going to go up, okay, because she needs to supply all of the building blocks that the baby needs to grow. The kidneys are going to be making more urine because the kidney is going to remove mum's wastes, but also the baby's wastes as well, okay? So that means that the mum's bladder is going to fill up quicker and needs to be emptied more often. And also, when you get to your later stages of pregnancy, the baby will actually push down on the bladder as well. Right. We know that the placenta is like the gateway, the gateway where baby's blood and mum's blood interface, where they meet and exchange things, right? So the blood that is going into the placenta actually comes out of mum's available blood supply. So she's lost that blood. She can't use it. Mum can't use the blood that's sitting in the placenta. On top of that, the baby's going to take stuff from mum's blood and it's going to put all the wastes in mum's blood. So as you can see, that mum's blood volume to adapt to that, to cope with that, will increase by 50% in order to deal with these changes, because everything is happening via the placenta. You are delivering all of the nutrients, all of the gases, everything that's required via this placenta, okay? So the blood is the transport medium between the mum and the baby. Right, so let's just do a quick kind of overview of how the beautiful development of the human fetus comes along. So 8 weeks, there are significant changes associated with the fetus, and the 12th week, you can actually tell the sex, but I think it can't be detected. I think ultrasound, they do that from the 20th week, I think. Yeah. So when did the heart start pumping blood? You should be able to grab that from that table. Just have a bit of a read and just be aware of any significant changes that happen as the weeks go on with regards to pregnancy. Okay, so look at that, the 16 weeks, all the joint cavities are apparent, okay, the 5th month, okay, so it's getting longer, it's growing, and then, the spinal cord starts to become myelinated and the eyes open, okay, and then you've got more things happening here. Okay, just think about, substantial changes that you would see in a fetus over time, just to get a bit of an understanding. I don't expect you to remember all of this. Just answer the questions that I have there for you. Okay, I have this other video here that I want you to watch. You can do that one in your own time because it just shows all of the sequence of events, I think from fertilization to birth, if I'm not mistaken. Just have a quick look here. It just summarizes everything that we looked at in this lecture, but I'll let you look at that in your own time. Right, so now we're going to look at labor. Now, I did do some research on this, and it's slightly different to what it actually says in the book. I've learnt that there are several factors that contribute to the onset of labor, okay? And these triggers can be hormones, mechanical, whereas I think the textbook only really gives you part of the story. Oops, Jody sent me a message. Okay, so at the end of the day, I think the research says that there's factors associated with the onset of labor, but it's not well understood. But I guess for you, as being a health professional, it's probably helpful to know what signs and symptoms to look out for if you think someone is actually going into labor. So let's look at those. Pain, okay? That's a really big sign. Watery or blood-stained loss, so that's coming out of the vagina. Gastrointestinal symptoms can actually be an early sign of labor. And emotional changes as well. And also altered sleep patterns can also be a sign associated with an onset of labor. Okay. And let's have a look at the stages of labor. Here is your placenta. Here is your vagina and your cervix. Okay, so when you go into the hospital, they will tell you how dilated your cervix is. Okay, here's a cord, here's a placenta. Yeah. And then here we go, and here's the delivery of the infant face first. They should come out face first. And then after the baby is born, then what you need to do is you actually need to deliver the placenta. So the placenta actually comes off the uterus and you deliver that as well. It's about half an hour after you've delivered the baby, you deliver the placenta. And that's it. And that's how you came about to join us in this world.